60,000 Americans are diagnosed with pancreatic cancer each year, and in an alarming trend, by 2040, it's on track to become the second leading cause of cancer death among adults, just behind lung cancer.
Pancreatic cancer continues to be a tough malignancy.
Dana-Farber Cancer Institute's Dr. James Cleary treats patients with pancreatic cancer and studies potential new treatments. He says a major frustration is that immunotherapies and targeted therapies that are FDA approved in other cancer types are not effective in the vast majority of patients with pancreatic cancer. Add to that, it's tough to detect.
The majority of patients we see, we catch late. We catch when they're not candidates for surgery, where we really don't have curative therapies. And we know the earlier we catch pancreatic cancer, the better the patient outcomes are going to be. But this is a really, really hard problem.
But Dr. Cleary says there is also hope. Recently, the FDA approved a drug that's effective in a rare form of pancreatic cancer. Even though it's not the majority of patients who will benefit, Dr. Cleary says it's a watershed moment because it proves there are drugs out there that can work.
We're excited about this, and we're really hoping that this is going to bring a future line of therapy for pancreatic cancer patients that we really couldn't imagine before.
Dr. Cleary says they are also learning more about warning signs of pancreatic cancer, including a possible link to new onset diabetes.
Most people who get diabetes don't get pancreatic cancer. So how do you figure this out? And so the approach that the Farber has been taking has been using artificial intelligence.
Plus, thanks to patients wanting to participate in research, Dana-Farber has a robust biobank of blood samples and organoids, which are tumor cultures that can help researchers test out drug therapies in the lab. Dr. Cleary says all of this gives him hope for the future and motivates everyone to accelerate research.
Want to leave people hearing that progress is being made in pancreatic cancer. So our outcomes are getting better. We still have a long, long way to go, although there have been reasons for optimism.